Hi, I'm Dr. Srinivasa Rao. I'm a diabetes care specialist. I help diabetic patients in controlling their blood sugars and preventing diabetes complications. Today, we are going to talk about the 5 signs of kidney disease in a diabetic patient. When you observe these 5 signs in a diabetic patient, you can easily pick up any complications to the kidney, which is called as diabetic nephropathy. Diabetic nephropathy is one of the most serious complications of diabetes which cannot be reversed. So it makes us very vulnerable for the kidney diseases if we have been diagnosed with diabetes. Today I'm going to tell you 5 points by which you can easily pick up if there is anything wrong with your kidneys so that you can seek medical advice, prevent diabetic kidney complications. Point number 1, there is swelling in your feet, ankles. You have puffiness of face. You have bags under the eyes. When you see that, suddenly the patient is looking puffy or you feel that he has bloated up, you can easily understand that there is something wrong with his kidneys. If you find any such thing, please seek a doctor's help, get a kidney test done, which will help you in preventing very severe complications of diabetic nephropathy, which, as I said earlier, are not reversible. Second point, fluctuating BP, which is not coming under control in spite of use of medications. When you take your BP readings and you find them on the higher side all the time and they are not coming to normal of less than 120 by 80, in spite of using medications, in spite of controlling your diet, it might mean that you might have been having a diabetic kidney disease, which is also called as diabetic nephropathy, as we discussed earlier. Once your BP increases, once you have puffiness of face and you have water accumulation in the body, that will lead to the third complication called as breathlessness. Meaning to say that you are not able to do the work which you have been doing very easily all these days, and it has become increasingly difficult for you to run your daily day-to-day tasks and activities of daily living. When you feel that you are having breathlessness, please seek your doctor's help. I'm again telling you, if diagnosed early, diabetic kidney complications can be prevented. If neglected, as we were discussing below, they cannot be reversed. The fourth complication is nausea and vomiting. Because of increased urea and creatinine in your blood, a patient with diabetic kidney disease experiences constant nausea, feeling loss of appetite, and he might have continuous vomiting at times. So, when a patient is having swelling, patient's BP is fluctuating, the patient is having shortness of breath and having complaints of nausea and vomiting, having loss of appetite, it means that there might be something wrong with the kidney. If you find any of these symptoms, please seek a medical advice. As I said, that diabetes nephropathy can be prevented but cannot be reversed. And the fifth complication is fluctuating blood sugars, meaning to say that you might have what is called as a brittle diabetes. On a given day, your blood sugar can be very high on the same day and it can go to very low on the same day. If these things are happening, please seek your doctor's advice and rule out diabetic nephropathy. And the most common presentation in late stage diabetic nephropathy is confusion. If the patient is confused, he is not able to talk to you properly and he is not able to respond to whatever you are saying, it might mean that he might be having a diabetic kidney disease. Please seek medical help and you can help a patient in preventing his diabetic nephropathy.